Chorioretinal toxoplasmosis complications. Chorioretinal toxoplasmosis complications. Ocular toxoplasmosis and inflammatory disease caused by infection with the protozoan parasite Toxoplasma gondii, in the most common case of posterior uveitis.
Toxoplasmosis is considered to be a leading cause of death attributed to foodborne illness in the United States. More than 60 million men, women, and children in the United States carry the Toxoplasma parasites, but very few have symptoms because the immune system usually keeps the parasites from causing illness. What is toxoplasmosis? Toxoplasmosis is a single-celled parasite called Toxoplasma gondii. Causes a disease known as toxoplasmosis. How do people get toxoplasmosis? A toxoplasma infection occurs by 1. Eating undercooked or contaminated meat, especially pork and lamb. 2. Drinking water that is contaminated with the parasite. 3. Accidentally swallowing the parasite through contact with cat feces that contain toxoplasma. 4. Ingesting contaminated soil, that is, not washing your hands after gardening or eating unwashed fruits or vegetables from a garden. 5. Mother to child or congenital transmission. And 6. Receiving an infected organ or transplant or infected blood via transfusion of blood, although this is pretty rare. What are the signs and symptoms of toxoplasmosis? Some people who have toxoplasmosis may feel as if they have the flu, with headaches, fever, sore throat, swollen lymph nodes or glands, muscle aches, and pains for at least a month or more. Severe toxoplasmosis causing damage to the brain, eyes, or even other organs can develop from an acute toxoplasma infection or one that had occurred earlier in life and is now reactivated. Signs and symptoms of ocular toxoplasmosis, for example, can include reduced vision, blurred vision, pain, redness of the eye, and sometimes tearing of the eye. Most infants who are infected while still in the womb have no symptoms at birth, but they may develop symptoms later in life. A small percentage of infected newborns have serious eye or brain damage at birth. Who is at risk for developing severe toxoplasmosis? Well, infants born to mothers who are newly infected with Toxoplasma gondii during or just before pregnancy. Persons with severely weakened immune systems, such as individuals with AIDS, those taking certain types of chemotherapy, and those who have recently received an organ transplant. What is the treatment for toxoplasmosis? In an otherwise healthy person who is not pregnant, treatment is usually not needed. If symptoms do occur, they typically go away within a few weeks or a month. For pregnant women or persons who have a weakened immune system, medications to treat infection include anti-malarial drug and other antibiotics. AIDS patients should continue treatment for as long as their immune system is weakened to prevent the disease from reactivating. How can I prevent toxoplasmosis? Kind of like a quarantine of your pet. I hope this video was useful to you. Take care and visit EDX Video for other educational videos like this one. Thank you.
Applications in medicine. Background. The purpose of the retrospective clinical study was to demonstrate vascularization of peripheral hyperplastic chorioretinal scar in present congenital toxoplasmosis by choroidal disease, and secondly, to report vasoproliferative tumors of the sensory retina, seen in association with such lesions. Method. Retrospective study of the cohort of the 15 patients with peripheral hypertrophic chorioretinal scar, including fluorescein angiography and enthusiasm. Green angiography. Congenital toxoplasmosis was serological confirmed in 7 cases and suspect on clinical grounds in 6 cases.
If there is a strong adhesion between the retina and the vitreous, the posterior vitreous detachment can cause a traction on the retina. If the retina itself is fragile at that particular point, this can lead to a retinal tear, which will allow the intraocular fluids to go through and detach the retina. In the large majority of cases, there is nothing that indicates that a retinal detachment will occur before it actually happens. Physical symptoms perceived by the patient might be flashes of light, a shower of floaters, or a loss of peripheral visual field that the patient will not notice most of the time until the central vision has been affected. Without rapid surgical intervention, preferably between 8 and 15 days, the retina can become retracted because pigment cells will start to form membranes over the surface of the retina. When the retina is retracted, surgery becomes much more complicated, and the chances of healing are severely diminished. The first goal of surgical treatment is to stop the fluids from passing through the tear by plugging it. The pumping done by the pigment epithelium allows the retina to be reattached. To do this, the surgeon first needs to find all the tears or holes, no matter how small, in order to induce an inflammatory reaction on the edges of the holes or tears by cryopexy or laser. This reaction will act as a glue when the tear will be pushed against the pigment epithelium. This can be done in several ways. The doctor can reshape the sclera, pushing it against the tear by doing a scleral buckle. Using an explant suture to the sclera, he can do an internal tamponing by pushing the retina against the pigment epithelium and then injecting a bubble of gas into the eye. This bubble will then be absorbed naturally. For complicated cases, a silicone bubble is sometimes used instead, though it must later be removed. Lastly, he could remove the vitreous tractions that caused the detachment in the first place, thus giving the retina back its flexibility. This is called a vitrectomy, or removal of the vitreous. All of these procedures can be done together, as well as with other complementary steps, like membrane dissection, or removal of the fluid underneath the retina. The failure rate of the first surgery is always present, because a surgeon cannot completely account for the range of outcomes that can occur with each individual detachment, especially if it is advanced or involves complications. It is necessary to restart the procedure, given that since a healed state is not maintained, the condition continues to contribute to permanent vision loss.
Receipt 16A exhibited a peripheral complex scar with a posterior atrophic and an anterior hypertrophic part. These scars were vascularized from the choroid in aid of these aids. An additional vasoproliferative tumor was seen within or adjacent to the scar, and in one fellow eye, a vasoproliferative retinal tumor was found as well. Pros and cons. Cons, no pros. Nervous system involvement can lead to seizures, development delay, deafness, or other CNS lesions. Ocular disease can lead to visual impairment or rarely blindness. Acute infection in the immunocompromised may cause hemodynamic abnormality similar to septic shock. Other possible, although uncommon complications in IBS patients are function during terms, diabetes insipidus, syndrome of inappropriate antidiuretic hormone secretions, orchitis, and myositis.
Hi, my name's Janet, and this is my son Shay. Shay was born in August 1998. He was a full-term healthy baby when he was born. At his 6-week checkup, he was noted to be jaundiced still, and the doctors had no idea why. There were some concerns, but nothing extraordinary because he seemed to be eating well and growing well. However, by the time he was 10 weeks old, he was having additional problems. They thought it might be his liver. He underwent an open liver biopsy, which came back negative. The jaundice did not go away. He had a couple of seizures, which led them to believe it might be neurological in nature. And the neurological tests were being done when at 12 weeks he became extremely lethargic one day, would barely wake up from his nap. He began seizing. We treated this disorder, which of course proved to be wrong. He started out in the 10th percentile and has since moved up to the 65th percentile with the help of the medication. He has had some bumps in the road. He's had several crashes. They would never, ever, in a million years, really guess he has any disorder at all.
What do you do these days?
I go to school, play with my friends, and play soccer.
We've been a member of MAGIC now for 10 years, and it's been a huge help along the way.
Diseases. Systemic infection. Congenital disseminated infections can cause a range of problems, including intrauterine growth restrictions, microcephalic header defects, osteomyelitis, endometrial liver and spleen, dermal erythropoiesis, carditis, and congenital heart disease. Acute system infections with the above pathogens also cause a range of problems. Infection in the immunocompromised patient can be severe and life-threatening.
Our last disease for the section on ophthalmology. The last disease for the section on ophthalmology is uveitis. Uveitis, well, let's see. I think that's an itis of the uve. Yes, it's 100% inflammation of the uve. What's the uve? What's the uveal tract? Which part of the eye is your uvea? Uvea. Psoriasis, sarcoid, syphilis. Writers, psoriasis, sarcoid, syphilis. A lot of S, because this disease is terrible. Therefore, writers, psoriasis, sarcoid, syphilis give me a red, inflected, inflamed eye, which really feels terrible. So the treatment is to treat the underlying disease, whether it's writers, psoriasis, sarcoid, syphilis. It fits. And there is our ophthalmology section. I wish you so well. I am so small, my heart is so small. How can this great love be inside of you? Look at your eyes. They are small, but they see enormous things. Goodbye.
Microphthalmia, cataract, uveitis, systemic manifestation of the other cases of chronic rhinitis such as autoimmune conditions, malignancies, and sarcoidosis. Thanks.